I'm Hazal, and I'm from Turkey, and I'm a member of Youth Coalition for Sexual and Reproductive Rights. Youth Coalition is a Canada-based organization, and we work for advocacy in international spaces as well as at local and regional levels for youth sexual and reproductive rights. So we really want to make sure that young people they have access to these international advocacy spaces. They know how to use these tools, which are very, very important because these spaces give us kind of points of references with all the past recommendations that have been done, but also kind of platforms of engagement so that we can actually just what I do here this week, that we can push forward. We can discuss with missions on what is on our agenda and what is important, and we can actually, because we have contacts with local organizations, we can gather their voice and be present here in Geneva to convey their message. So this week I'm here to follow Turkey's UPR review, and which will be in January, and now soon it will be the press sessions, and we worked with Sexual Rights Initiative and UPR Turkey, as well as with my colleagues at Youth Coalition, to submit some recommendations, to push forward some recommendations for Turkey on comprehensive sexuality education and access to abortion that we believe are very important. The problem with comprehensive sexuality education in Turkey is that at the moment we do not have a standardized mandatory curriculum that is applied across the country, and the curriculum we have for the moment is very much focused on reproduction, but it lacks content on consent. It also lacks a kind of a human rights-based approach. We wanted to invite the permanent missions here to recommend Turkey to adopt a comprehensive sexuality education curriculum that has a human rights approach and that is based on scientific evidence. In Turkey, abortion on demand is legal until the 10th week of the pregnancy. However, there are a lot of problems when it comes to access to abortion, and many women in Turkey actually do not end up not accessing abortion, even if it's in the law. And sometimes we talk about a de facto ban, meaning that even if it's the law, it is not the reality for many women. So one major problem with it is that recent studies show that only 8% of public hospitals offer abortion services, so the service provision is mostly shifted to private sector, which means that it's actually women who are from lower economic backgrounds who cannot access to abortion. We also have some recommendations with regards to the legislation itself. One problem with that is that at the moment, if a married woman wants to access abortion, she needs to get the permission of the husband, and if an underage girl needs an abortion, she needs to get the permission of her guardian, which is against the bodily autonomy of the individuals, because they need a third-party consent, and this also appears to be an obstacle for many women who need abortions. Another problem, again with regards to access to abortion, is that we have a significant urban-rural divide in Turkey, and this is one reason of this is kind of related to the legislation itself, because only at the moment only specialists can, so gynecologists can offer abortions, but in many countries we know that, for example, general practitioners and midwives can also offer abortions. So if we could actually amend the legislation in that regard, it could potentially increase access to abortion in rural Turkey as well. And the final thing is that at the moment the only abortion we have in Turkey is surgical abortion, and still medical abortion is not registered in Turkey. So we also recommend, we want to invite states to recommend Turkey to register medical abortion as well. So in preparation of this press session, we submitted a report, and we also prepared kind of a one-page document kind of listing our concrete recommendations. And we noted that insofar there have been no recommendations to Turkey on comprehensive sexuality education, which we believe is very important. So we really want to attract attention to this fact, and also we really want to convey this reality of women. As I said, we have the law, but women do not have access to abortion in Turkey. We want to share this with a larger community, so that we can create change as young people.